Okay, welcome back. I am glad we are still together finishing up this discussion of diseases. In chapter 23, we're going to talk about diseases of the cardiovascular system and the lymphatic system. So if there is just a pathogen or a toxin in the blood, it is called septicemia. It's a word we've discussed already. Lymphangitis will occur when there is an inflammation of the lymph node, and you get these red streaks shown in the picture. Then septic shock is a life-threatening decrease in blood pressure associated with an infection. This septic shock cannot be controlled by fluids and will lead to organ dysfunction. So let's start with puerperal sepsis or childbirth fever. This is what we discussed when we talked about Ignaz Semmelweis. This is caused by the bacteria Streptococcus pyogenes, which can infect the uterus. It can cause an infection during childbirth or abortion. However, now it's uncommon because we now know to wash our hands, and we can also take penicillin. Endocarditis is an inflammation of the endocardium, which is the inner heart wall, and pericarditis is an inflammation of the pericardium, which is the outer covering. So endo tells you it's inner, and peri means it's around the perimeter. So endocarditis can infect not only the inner heart wall, but also abnormal valves. And if it does, that can lead to blood clots. Rheumatic fever is a complication of Streptococcus pyogenes. It often follows strep throat. So if that strep throat wasn't treated correctly or appropriately, it then can go on to rheumatic fever, where it can lead to these nodules, subcutaneous nodules at the joints, and also can inflame the heart and damage heart valves. Tularemia, sorry, my dog is in here. Tularemia, which is caused by Francisella tularensis, is also called rabbit fever because it can be transmitted through rabbits and ground squirrels. It can lead to enlarged lymph nodes and create these lesions. Mortality rate is less than 3%, which isn't huge, but is also kind of significant. Brucellosis is also known as undulant fever. It is caused by a Brucella melitensis, and the reason it's called undulant fever, undulant means up and down, like swaying back and forth, because symptoms will rise and fall. Your patient will feel sick, then they'll feel better, then they'll feel sick, then they'll feel better. This is associated with ingestion of unsterilized milk or meat. So infections like this are one of the reasons why there are rules about pasteurizing milk that is going to be sold for people. Sometimes this is called Mediterranean fever. It can lead to muscle pain and sweating. And because it is easily airborne, this is on the list of potential bioterrorism agents. Then anthrax, we've already discussed anthrax, that it can be pulmonary, which is a lung infection, cutaneous on the skin, or GI in your gastrointestinal tract. Anthrax is caused by Bacillus anthracis. Gangrene and gas gangrene, both caused by Clostridia. In gangrene, just plain gangrene, there will be necrosis. These are actually dying tissues, resulting from a loss of blood supply, which is called ischemia. Substances will be released from those dying cells that then are used to feed the bacteria and just keep that infection going. And then gas gangrene, which is Clostridium perfringens, then also has carbohydrate fermentation leading to gas bubbles. So you get these gas bubbles. And this is called crepitus. Crepitus is when those air bubbles will crackling. Then a few more diseases we've kind of touched on already. Cat scratch disease caused by Bartonella henselae. Plague caused by Yersinia pestis. Lyme disease caused by Borrelia burgdorferi. Rocky Mountain spotted fever caused by Rickettsia rickettsii. So those we've already talked about. Then endemic typhus. So I told you earlier when we were talking about lice that they can carry a disease known as endemic typhus. Typhus and typhoid, different diseases, so don't let those familiar names get confused. But endemic typhus is caused by the bacteria Rickettsia prowazekii. That word typhus means smoky because it can cause your patient to feel delirious. It can progress from a fever to having a red spots, to having a rash, to that delirium, to developing into gangrenous sores that are going to start rotting and stinking. This bacteria can invade vascular epithelial cells and cause a local blockage and rupture of small vessels, which is what then leads to the gangrenous sores. And this is again carried by lice. Then let's talk about hemorrhagic fevers. So a hemorrhagic fever means that there is internal bleeding around or in the organs of that person's body. The classic ones are kind of the older ones, and then there are some emerging ones that are more new in terms of like timeline. So yellow fever is transmitted by this mosquito, Aedes aegypti. And again, if you can just tell me it's transmitted by a mosquito, I'm happy with that. The reason it's called yellow fever is because it damages the liver, and that leads to jaundice. So jaundice is kind of that yellowing, oranging of the skin. This is most common in tropical areas because that is where the mosquito vector lives, and it has a mortality rate near 20%. So this is a very serious one. This mosquito, though, is, as global warming is allowing the mosquito to move to more northern locales, it can be spreading outside of those tropical areas. Dengue is a more mild form. It also has a mosquito carrier. Sometimes it's called breakbone fever because it will just have that pain, that joint pain. Also fever and rash, sometimes bleeding. It is mainly in the tropical area, Caribbean and tropics, because that is where that mosquito is, but it can be spreading to the United States. And here the mortality rate is less than 1%. Then our emerging hemorrhagic viruses. We have Marburg, Lassa, and Ebola. So Marburg is a disease that will cause bleeding from the orifices and vomiting blood. Lassa virus probably has a rodent reservoir. And then Ebola virus is very closely related to Marburg. It also will cause bleeding from orifices and mucous membranes. It seems like every 4 or 5 years there's another Ebola outbreak. Thankfully for us, none of those have traveled to the United States. It can be spread by contact with blood. So in some of the areas where Ebola outbreaks have happened, there have been, religious funeral rites that involved, preparing the dead body. So there's been a lot of cultural issues that have needed to be resolved to deal with limiting the spread of Ebola. It probably has a bat as a reservoir. That is not fully confirmed, but that is what most likely looks like the story. And Ebola outbreaks have had between 50 and 90% mortality rate. This eventually leads to the organs malfunctioning because fluids are being redistributed. They are not staying where they should be in the body. They're bleeding into their body. Then Argentine and Bolivian hemorrhagic fevers is going to be more like Lassa, although it has it is associated with rodent excretion in rural areas. Hanta pulmonary virus and Whitewater Arroyo virus are both hemorrhagic diseases in North America. In Hanta, the lungs will fill with fluid, and it is more commonly seen in outbreaks that have been in the western states. So sometimes it's called Four Corners or Nombre virus. Those 4 states, if I can remember, Arizona, New Mexico, Utah, and Colorado, I think that's the 4 states. And then Whitewater Arroyo virus, which is in California, transmitted through a California wood rat. This was the first hemorrhagic fever to be found in North America. Then infectious mononucleosis, sometimes called mono or the kissing disease, because it is transmitted through intimate contact, such as kissing. I remember when I was in high school, the band students like to play each other's instruments, and an outbreak of mono swept through the band, with the official reason being that they had been playing each other's instruments because I'm sure nothing else was happening there. This is caused by the Epstein-Barr virus, which can grow in the oropharynx, which then will infect their lymphocytes, their white blood cells. And so it'll develop into flu-like symptoms and swollen lymph nodes and can lead to rupture of the spleen. Then Burkitt's lymphoma is a tumor of the jaw. This is a childhood cancer that is caused by Epstein-Barr virus. This is Epstein-Barr, which causes mono, and Burkitt's lymphoma are related to human herpes viruses. Chagas or Trypanosoma cruzi is American trypanosome or American sleeping sickness. It is carried through an insect vector. So although trypanosomes are protozoans, it does have this insect vector, which is the reduvid bug or the kissing bug, called the kissing bug because it usually bites people on their face. And then it can travel and damage the heart, which will lead to death. It also can prevent movement of some of your smooth muscles in your esophagus and your colon. And then toxoplasmosis. This is a wild infection. Toxoplasmosis is caused by Toxoplasma gondii. It can be in your blood and lymph vessels. It uses both mice or rats and cats in their life cycle. And what I think is absolutely crazy about this is if it infects a mouse or a rat, these are animals that should be scared of cats, right? That should stay away from cats because cats are a predator. However, if the mice are staying away from cats, that protozoan is not going to have a way to finish its life cycle. So it actually can infect their brain and change their behavior to where they are no longer scared of cats. These mice that are infected with toxoplasma actually get more amorous when they smell cat urine and will spend more time around areas where they can smell cat urine, which means they're closer to cats, which means that cat then can capture it like cats do and eat it, and then that toxoplasma is able to finish its life cycle. It can be shed in cat feces and can infect people. In most people, if it infects you, it is probably not going to do anything. But if you are pregnant, it can infect the fetus and infect that fetus's brain, lead to stillbirth, brain damage, or vision problems. So pregnant women are often advised to avoid changing their cat litter so that they don't get in contact with Toxoplasma gondii. Something else about Toxoplasma, these infections are pretty rare, but it is associated, Toxoplasma is associated with schizophrenia, which is a mental disorder. There's not a lot of people that have toxoplasmosis and not a lot of people who have schizophrenia. So there's not a lot of people to study this on, but there is some evidence that an infection by toxoplasma increases a person's risk of developing schizophrenia. Most diseases of the brain, most mental disorders are going to be multivariable, have a lot going on. So I'm sure there's a lot more than just if someone has toxoplasma, they have schizophrenia. It's not that simple. But it may be something that increases the likelihood of that. Okay, so that is toxoplasma, right? I said this was a crazy one because it does all of this crazy stuff. Okay. Then malaria. Malaria is a protozoan, or is a disease caused by the protozoan Plasmodium. This is Plasmodium can infect red blood cells. So here you can see a red blood cell with all of these infectious merozoites, which is a life stage of the protozoan. It can be transferred by mosquitoes, a different type of mosquito than we've talked about before. These are Anopheles mosquitoes. So there have been efforts to control malaria, the protozoan, with antiprotozoan drugs, which worked well until they developed a resistance to it. There have been attempts to control the mosquitoes, which also developed a resistance. So, every now and then we get really close to cutting out malaria, to eliminating it, but it always seems to make a comeback and develop resistance. It causes kind of flu-like symptoms, chills, fever, vomiting, and headache. Although as the patient's body is making new red blood cells, we're constantly creating new red blood cells, they'll feel better for a while. Then those new red blood cells will get infected and they'll feel symptomatic again. So you have this alternation between feeling symptomatic and not. One thing that's very interesting is sickle cell patients are immune to malaria. So sickle cell patients, their red blood cells will be more shaped like a sickle, which is like a crescent moon kind of shape. And malaria cannot infect those sickle cells, red blood cells. Then leishmaniasis, caused by the protozoan leishmania, several different species of leishmania. This is transmitted through the bite of a sandfly, so it is mainly found in tropical and Mediterranean areas. For the most part, it's going to be cutaneous, like this, although it can become visceral and infect the liver and the spleen. And this was associated with troops in the Persian Gulf. There were a lot of troops that were affected. Then babesiosis, caused by Babesia microti, which is transmitted by the bite of a tick. So again, both of these are protozoan diseases, but the protozoan is transmitted by by the bite of another animal. So the protozoan Babesia microti is transmitted by the bite of a tick. This will infect red blood cells and resemble malaria, only because it has a different vector. It lives in a different area. So this is found in the Northeast and Midwestern United States. Okay, I will see you back in our next video where we're going to talk about our respiratory system. If you have any questions, please let me know. I'll talk to you later. Bye.